had in a long time.
And you're not, and people don't seem to be, some of the folks who are perpetrating some of this domestic violence, who are also in very, very high situations and high classes, who seem to ignore.
They're in all classes.
In all classes.
Nobody is exempt. Nobody is exempt. I spoke at MTSU a couple years ago, and the first thing one of the students said that, well, we don't have to worry about it because we're in college. And I had to get up and tell her, honey, you're not exempt. You're the one that won't count. We won't count because you won't tell anybody.
That's right.
Because of the security that you have. But everybody's everybody's at stake.
And of course, those individuals who are in college are in a situation to be advocates. In terms of that.
Because it's happening on the college campuses.
Speak to that. What are they telling you about college campuses? Because every now and then we find, we see a
very strong on college campuses. Now, the children won't talk about it openly to us, but they will talk to me when I leave. But it's very high.
And these are all generally unmarried individuals who have girlfriends or boyfriends or whatever, and they get into kind of...
domestic violence starts in the age 10.
Speak to that. I didn't know.
Little boys start beating on little girls at that age, and the children in high school are dealing with it. See, they think because he calls you 24 hours a day or every day and wants to know where you are, that he loves you. But no, he's possessing you.
Trying to keep track of you.
He's trying to keep track of you. So the little girls don't know. They need to be taught what's possessive and what's not possessive behavior, because it can lead to a form of possession.
Well, now, do you think that because since it's such a problem in all age categories and all economic categories, do you think that the school system, metropolitan school system, perhaps they do have some kind of program dealing with domestic violence that they could introduce? They don't have those kind of...
As far as I know, they don't.
Well,
as far as I know, they don't.
It seems to me that that would be the place.
It would be one.
That would be one of the places that people could start if we want to talk about really, if we are
sincere in breaking the cycle.
That's right.
You need to start in the classroom, and you need to start in the young classroom, because see, we all want to go to the ages of 10.
All right.
By the time those little boys get to 10 years old, they already have their habits formed.
They do.
So if you don't catch them at 3, then you're going to have a 10-year-old picking up a gun.
I know that I've got a granddaughter who's 5 years old and who's in kindergarten now.
She knows right from wrong.
Right, and she tells us about some of the young men that are there that are doing the kind of things that you would never expect a 5-year-old in kindergarten child to be doing. Touching them inappropriately and saying things and slapping them around.
And see, when you tell people that, they look, oh, that's not happening. Yes, it is happening.
But I'm finding out from her experiences, because she comes home every day and talks about that.
It's
and
real
she talks
life.
about it all the time, too, as if it's...
She's right. And see, those kids started this behavior at the age of 3.
Okay, and so by the time they get to kindergarten...
They thought it was cute.
That's
right. We all think our children are cute. I thought mine was cute.
But by the time they get to 5, 6, or 7 years old, and then later on they get into...
It's too late.
Yeah, it's a real problem.
It's a problem, man. It's a problem. And then everybody's got to take notice.
Very good. Yeah,
so if anybody wants us to come and do the presentation, just give us a call.
That's what I think would be important in terms of community centers, and those kind of organizations where they have these small daycare centers, whatever, and if your organization could somehow get in there and start dealing, at least leave some kind of program there with those folks. I think that this is... But would you say in a real sense that there's no real interest in dealing with domestic violence? Is that?
I don't think there is an interest. I really don't. But we've been successful with the project. We've done it twice at TSU. But the TSU was interested. And these are young adults. So a lot of them don't have children. Some of them did have children. So and we've gotten a good response from the ones that we did. We haven't done it to... the parents yet, so to speak. So that's our next presentation. Okay,
and very good. And of course, we've got about a minute and 30 seconds before we end this program for today, Mr. Jerrett. Perhaps there's something that you were thinking of perhaps leaving us with on the way out, outside the fact that you need money, and I think that we know that, and what we're going to do is try to do everything that we possibly can in terms of helping you to do that. But is there anything else that you think that we might be able to do as a community to assist you and those other 2 shelter centers that we have in metropolitan Nashville?
The other two shelters are pretty, yes. Just be supportive.
Just be supportive, and to recognize that it is not an isolated kind of thing, and that
and just think broadly about domestic violence. It's not in a cocoon.
Okay.
It's not AIDS.
All right.
It's real.
It's real. Very good.
It's real.
And of course, let me thank you over the last half minute that we have here, Ms. Jerrett, for bringing us that excellent information, and especially the ability to tie domestic violence into some of the health care problems, some of the gang problems and other problems that we're having.
Yes.
Because I think that when we can see it at that angle, and then we understand the cost that is associated with that, then we can probably come out and do something.
Thank you for having me.
Get organized in reference. We certainly appreciate you coming by. And of course, let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.